I was in the United States Marine Corps in the years 1968 and 70. And I was a hippie in high school. You know, I had the long hair and everything that would go with that. Very patriotic. Still to this day, very patriotic. Went to the Marine Corps in like September of that year, and they were trying to find some place to send me. It was Vietnam. We spent a lot of time walking. We'd go on an operation, and basically the operation ended when we got done walking and got back to our hill. If you were there and in combat, you were exposed to Agent Orange.
Military veterans during their service are oftentimes exposed to many different situations and substances and environments in which there's potential to have increased risk for developing cancer. Some radiation exposure that might be possible, and then everything in the air, burn pits, Agent Orange was used during the Vietnam conflict.
The VA determined that Agent Orange is the cause of prostate cancer. And he told me I had stage 4 cancer, and it's not good. And the VA accepted me into the Agent Orange causes prostate cancer.
I had done genetic testing on his tumor, and we discovered that his tumor had lost a gene. There was new information that had come out recently when we first started treating him. And so I started him on a PARP inhibitor, which is a pill, and he took it by mouth. His tumor started to respond. His PSA is now undetectable and has been undetectable for a number of months. So he's done very well.
Well, the VA has really made so much progress and is a leader in prostate cancer care. And the reason for that is they are really early adopters of a lot of new technology and tools that we can use for patients with prostate cancer, all across the spectrum of prostate cancer. We offer surgical treatments, including robotic surgery. We offer the most state-of-the-art radiation therapy treatments. For men who have advanced prostate cancer, we offer precision oncology approaches as we test the tumor for specific genetic alterations that might have a drug that is available to target that tumor very precisely.
And now with some of the newer treatments, the patients can live for many, many years. So I would encourage those veterans that have had military exposures, environmental exposures that might be carcinogenic, to discuss that with their provider and make sure that they know.
And I think one of the most rewarding things about working with veterans is their commitment to service. They still have that mindset. They have that gratitude and appreciation for the care that we provide them. It's really a pleasure always to work with the veterans.
I was proud that I was a veteran for this country. I would go now if they asked me to. They do the best that they can do to take care of me. So my coming to the VA was an answer to my prayer, and I'm not afraid of cancer.